So tell me a little bit about the model that you presented here in ALEC.
It's the freedom of choice model, very similar thing to what Sweden has already been doing, and we're experimenting with the model in Finland. The new law is in legislation. It hasn't been passed yet. It'll be passed this spring, so we don't know all the details yet. But what we're basically looking to do is to open the public health center type of care for us private providers to offer to our customers, and people get to choose where they want to have their basic level of services, meaning nurses visits and physician visits on a primary care level. Lots to do with developing customer experience for these patients, new digital services, looking into risk management, home care, self-care, and new ways of reaching us, because we're also doing this in rural areas like Norrbotten is providing a lot of their digital services.
So there's a lot going on in Finland and quite not so much time.
No, the whole country is reforming, and the social and healthcare reform will change the way public healthcare services are provided in the whole country. And at the same time, we're doing the governance structure reform, which will change the funding and the decision making in healthcare. So exciting times, and a little less than 2 years to go before the new law is passed.
And what is important to think about in this time of change?
Oh, endless amount of questions. I think the most important thing is to keep the focus on providing value for the customers and not get too thrown away into the governance and funding changes and details, but keep the eye on the ball, which is that we're really trying to deliver better care and more efficient care with less money really than we are spending today, because the growth of the healthcare expenditure has to be cut down to half, if not even more.
And you have already now like live chat with your doctor and so on?
Yes, we do. Our chat is really popular. You can open it from your mobile phone or via your computer, and the response time is great. So in less than 0.2 seconds you can reach a doctor, which I thought was excellent. I tested out myself, obviously, the minute I got to it, and it really works well for your basic needs of prescription renewal or asking about a symptom where you don't know whether you should see the doctor or not. Super service.
Do you think you need to change your mindset depending on technology instead of the doctor live in the room?
Yes, you do, and we've already seen that. Some physicians take on that very easily and find it very natural, and others really are hesitant with going into this new model. But I think it's with every digital service that you just need to use it enough to become comfortable with it. And obviously we're doing a lot of work to make it so easy and intuitive that it would be not only for the customers but also for our physicians easy to use.
And the conference, ALEC, what do you think about it?
Oh, lovely. I had a great time. I used to do e-health research, so I met a lot of good old friends and familiar faces, and obviously met a lot of new entrepreneurs and interesting companies from the area, and have heard a lot about similar problems than we have in Finland. So ALEC has been really fantastic. I'm still hunting for the northern lights, though. I haven't seen them, but the lighting here is great.